Usually, we have to get a complete health history. This is going to be very important because at the onset, we'll be gathering everything about our clients. What we are going to collect here are all subjective data. The health history is an excellent way to begin our assessment because it provides us the groundwork for identifying nursing problems. And at the same time, it will assist us and give us focus when we are going to do the physical examination. The health history is important in a way that it provides us, as what we have said, an information that will assist us nurses in identifying our clients' areas of strength, their limitations, as well as we will be having the chance to know them better. So, what are included in the health history? So, we have biographical data, the reason for seeking care, history of present health concern or illness, past health history, family history, review of systems for current health problems, and then the lifestyle and health practices. So, our primary source for this is our client. Okay, so we can use secondary sources like checking on and also reading the past medical records of our clients. So, what are included in the biographical data? Of course, we will have to gather our client's name, complete name, that is, the complete address, the phone or contact number, their gender, um, their birth date, provider history, the place of birth, and so on and so forth. That includes as well their marital status, the languages that they speak, as well as their religious or spiritual inclination or practices, their educational level, their education, and also the contact number of the person that we would be um, talking to in case of emergency or untoward incidents aside from the client himself or herself, or we have the significant others or support persons if available. So then we will have to get the reason for seeking care. So this is a brief statement of the patient's reason for requesting the services of a healthcare professional, or the reason why the client is seeking assistance or is visiting the healthcare facility. So, this is usually described in terms of a chief complaint. We call that the chief complaint or the presenting problem. And this is often written or recorded in the rec codes, verbatim, how the client answered our question of like, what brought you here? What made you come over here? What is your reason for seeking healthcare assistance? So the manner or how we go over with the reason for seeking care would be dictated or depends on the condition of our patient. Like for example, there is an urgency to provide care to the patient, especially if there are concerns or problems with the airway, with breathing and circulation, or there's injury, or let's say there's an emergency situation. At this point, we can delay completion of the biographic data. Okay, and we can proceed immediately to addressing the health concern. And we can, once the client is stable, once the client is better, then that's a time that we can continue with gathering um, biographical data. This is to consider the the priority at that point in time, which is to address the patient's need. So again, the reason for seeking healthcare would address the question of their major health concern or major health problem at that point in time, or what prompted them to visit the hospital, what prompted them to seek consult. And so we would like to know as well um, their main health concern, they're the most significant health concern for them at that time. So we usually call this as the chief complaint. And then we gather the history of present illness or the HPI. Usually, this is a symptom analysis or a systematic method of collecting data about the history and status of the symptoms experienced by our client. This is a detailed description of the concern. So, there are several mnemonics to completely get the HPI. But for this time, we're going to use the cold SPA. Okay, so this would entail the HPI would entail that we gather data about the onset of the symptoms, the location and duration of the symptoms, the characteristic, the aggravating factors or alleviating factors, or other related symptoms, such as well as attempts of the client and the family to address the problem themselves, as well as the severity of the symptoms. Okay, and the client's answer to the question that we ask him or her would provide us a great deal of information about the problem and how this condition or this illness affected the client's lifestyle and activities or daily living or the ADLs. It also helps us to evaluate the client's insight, the perception of the client of his or her problem, and what are the plans of the client to manage his or her condition at the time. And as well as when we gather the HPI, we can also begin to formulate nursing diagnosis from the findings that we will get. Okay, so when we use the cold SPA and mnemonic, so C would stand for character. So here we ask the client to describe the characteristic of the symptom. So like how is it? For example, if the sensation is it stabbing, dull, aching, throbbing, nugging, okay? And then we also ask the client to describe, okay, the onset or when the symptoms begin or when he or she started to feel the symptoms, okay? We also ask as well if the symptom or the symptoms develop suddenly or it took a period of time for him or her to really notice it based on the interruption of the symptoms to his or her ADLs. And then we ask as well for letter L, the location, specific location of the symptoms. So we ask if they have it, they feel it on a specific area, or is the symptom or are the symptoms vague or generalized? Or does it radiate? Does it occur anywhere else? So that's when we ask for the location. And then for D, that means the duration. So we ask the client how long does the problem last, okay, or does it recur? And then we ask for the S or the severity, how bad it is, okay, how much it bothers him. For if it is pain, we ask the client to scale it. So we ask him or her to rate it on a scale of 1 to 10. Then we have the pattern. Okay, so the pattern would determine what makes the sensation or the symptom better or worse. Okay, um, the at this point we also ask if the client had attempted to do self treatment. Okay, before seeking care. So we ask what are those, like did he or she take medication? If so, then what's the specific medication, the dosage, and the time of the last intake of the medication? And then we have the associated factors. How does it affect the client? Like, for example, if it's pain, is the client unable to go to work because of the pain, or um, the activities of the daily living of the client that are affected. So we also ask that. So when we go and check for the history of present illness, we need to ensure that to ask all of these questions to him or her. And then we have the past health history. So when you say the past health history, that includes the the conditions that our client might have had in the past that could be affecting him or her currently. And that includes childhood illnesses like measles, mumps, rubella, whatever it is that he or she uh, experienced, no? Especially the common childhood illnesses. And then we have surgery. So we ask if our client had a history of surgery or surgeries, and then if so, for what, what's the type, when, and what happened, what's the outcome. And then we also ask about history of hospitalization. So we ask what's the reason, what's the purpose for being hospitalized, and then when, and then what happened, what's the outcome. We also ask about injuries or accidents, like for example, had our client an experience of fractures, lacerations, fall, and then when was it and what happened. Okay, we also ask about the immunization history. Okay, um, specifically about the the immunization that we provide, no, in the government. We need to ask if we need to know if our client is completely immunized, what he or she should have already been immunized. And right now as well, we ask if our client had received the COVID-19 vaccine, and if so, um, did he or she complete the dosing. So that's going to be about the immunization. And then we also ask if your client had examinations done on him or her, like physical examination, dental examination, visual, hearing, and other tests, no, that was conducted on him or her. And so if yes, then you ask when, and then we you also ask for the outcomes or the results of this examination. Okay, and then we if our client is a woman, then and a woman of reproductive age, then we ask about the obstetric history, and that includes if he or she was pregnant or had been pregnant. If so, how many pregnancies have she had? How many pregnancies reached full term? If there are, if she had miscarriages or abortions. So we need to know this as part of the past health history. And then we ask about family history of our patients. So in here, we need to determine specific genetic predisposition, as well as because there are diseases that have genetic predisposition. Okay, and we also have diseases that could be acquired by your client because of influence and exposure, like um, exposure to smoking. If um, he or she has a family member that is smoking, although smoking could not be directly related to being genetic, it could affect us by exposure. Okay, and then how many generations should we track back? So as much as possible, as long as the client can remember, you can track back up to the three generations back. Okay, and that includes both the maternal and the paternal side. So as you do your family history, then that's a time that you are going to make or draw a genogram. So example here are different types of genogram, but if you can see it, there's usually what you call as universal symbol. Like for example, if it's a male represented by a square, so for female represented by a circle. So if the person is already deceased, then we put an X in there. So don't forget to write the legend, okay, and what those colors, what those figures or shapes would mean, so that at this time we can as well like identify, like if the person is already, the relative is deceased, then we can see there what's the cause of death. Okay, if the deceased is if the relative is still alive, then you can write in there as well the current health problems experienced by, or any health problems experienced by the relative. If so, there is none, then you could probably there AW, which means alive and well. Okay, relationships of like um, if the family member is adopted, then we can probably use a broken line. Okay, and so this is how we do our genogram. It will provide us the presence of different um, diseases or illnesses that could be considered genetic, so we can as well relate the the history of the family to our client's current condition. Of course, you don't forget to summarize. You summarize the findings so that um, like how do you summarize? Like you write down what are the commonly occurring genetic problems within the family history, or what are the possible exposures that your client might be having or might have had based on the genogram that you draw. And then we have the review of systems. So here, when you say review of system, that is about the current health problem. So each body system is addressed and the client is asked specific questions. Okay. We ask about current health problems or problems from the recent past or any recurring problem. Okay. So when we ask our client about this, it is important for us to use terms or terminologies that our client understands. Okay. While you use common words and phrases when asking, make sure that you record your findings in standard medical terminologies. Okay, so when we do our ROS or review of systems, please take note that we only include the client's subjective information and not our observation. Our observation will be included in our physical assessment. So when we are doing review of systems, it's usually us interviewing or asking our client about the specific system of the body. Okay, so what are included in the review of system? Basically everything about our clients body or physique. So we have the skin, hair, nails, head and neck, eyes, ears, mouth, throat, nose, and sinuses, the thorax and lungs, the breast and regional lymphatics, heart and neck, vessels, peripheral, vascular, the abdomen, the genitalia, anus, the rectum, and prostate, musculoskeletal, and the neurologic system. Then after we had done the review of system, then we go check the profile of our client when it comes to lifestyle and health practices. So we would like to know about our clients' human responses like nutrition, habits, activity of daily living, exercise and sleep and rest patterns, as well as self concept, okay, and social and community activities. So we asked how the client manage life. Okay, also the awareness of your clients with regards to his or her living patterns. If client um, is a client aware of his or her living patterns being healthy or unhealthy, as well as we want to also identify the strengths and supports that they have. So we ask our client questions wherein we can get this information. So while we are assessing this area, we need to use open-ended question so that we can encourage the client to verbalize, to give us more information, as well as to enhance or promote our dialogue with our client. At the same time, while our client is talking, it is important as well to pay special attention to non-verbal cues. Okay, so what are these lifestyle and health practices? So we ask our client to describe what's in a day, what's in a typical day, nutrition and weight management, activity level and exercise, sleep and rest habits and patterns, substance use. So this includes um, using medications, if medications are prescribed or maintenance medications, is our client using supplements, herbal medication or herbal supplements, or um, even so if our client is using other substances. And then we also ask about self-concept and self-care responsibilities, social activities, about relationships, values and belief system, education and work, stress levels, and coping styles. So these are the components of a complete health history.